Hi folks, it's Dr. Jeffrey Roth here, your board certified plastic surgeon in Las Vegas, Nevada, and we are back at it again. Who'da thunk it?
Exactly, and it's a beautiful day in Vegas, actually. This is a perfect time of year. Not too hot, not too cold.
It's absolutely, we're actually doing this over at Mark Chinook's The Space in Las Vegas, Nevada, and today's high was like 60 degrees, which ain't bad.
Perfect.
For January. Apologies to all of my East Coast friends. They'll get me back in August, but basically right now they're in the middle of a bomb cyclone.
Nothing like Wisconsin in January.
Yes, no, I mean, great people up there and Canadian stuff like that, but minus 40, that just hurts just saying it. So,
exactly, yeah. So today, I think we're going to talk about the dangers of choosing your surgeon through social media, which is a really common thing that it's been happening with the kind of the world we live in.
Sure. So yeah, social media obviously is the 800-pound gorilla in every room now in medicine. And of course, when I was in medical school, none of this existed. And now you go to any of our big national meetings, if we ever get to have a big national meeting again, and there's a dozen places that'll tell you that, oh, I can get your website on the top of a Google Doc, or hey, we can manage your social media, et cetera, et cetera. And it's really become a very interesting place where you have the science and art of medicine, and you want to get good information out there, and you want to get, as a teaching point, which we try to do in our social media, but at the same time, the advertisers or folks that want to get their kind of message out sometimes will go and push the envelope a little bit too far.
Right.
And so
it's a very tricky balance, right?
It's a very I think so. And everybody that comes up to me and says, hey, Doc, I see you on social media all the time. The first question I ask is it okay? Is it not too cheesy? I say, no, it's the right balance, et cetera, et cetera.
Right.
Because we want it to be entertaining, but we also want it to actually, at the end of the day, maybe even teach something, God forbid. So, but to your point is there is lots of folks out there that have a million viewers or followers, or hundreds of thousands of followers, and they may not even be physicians. They may not even be board certified in plastic surgery or even dermatology or oculoplastic surgery.
Right. They might have a great social media person,
right,
but may not have the back end of the qualifications.
Right. Like anything else is caveat emptor. You really have to look and be very, very cautious, especially when it comes to a procedure or something that is about your health. And even we're on Instagram, et cetera, and I get these ads, because now it's pay for play in some areas. And I'm like, oh, who's this guy? And I go ahead and I look him up, and I'm like, oh my gosh, he's got beautiful ads, he's got a lot of followers, and a very great presence and everything else. But I'm like, oh my goodness, yeah, not somebody who I would refer to. I'll put it that way.
Right. So, and we should say, because you were actually the past president of the Clark County Medical Society, you're very familiar with, especially in Nevada, who's practicing, who's not practicing, what their qualifications are.
Sure. And there's lots of really good doctors here in Las Vegas, and we have really some gems. We have Children's Heart Center of Nevada. We have the LaRuvo Center for Brain Health, which is run by Cleveland Clinic. We have 2 medical schools here in town, maybe 3 coming. We have one up in Reno. So there is a real thriving medical place here. People are coming to Las Vegas for medical care. There are really good physicians here. It's just they're hard to get into because we're so underserved.
Right.
Now, having said all of that, and that's that can be an hour discussion in of itself. But like anything else, you really have to look. And he or she may have great befores and afters, or they may have a terrific page, or they may have a terrific amount of followers. But again, you have to do the research. You have to say, okay, is this guy or gal, what's he trying to educate me on? Is it something that's really educational, or is it something that he wants to sell me? So that's one.
Right.
2 is okay, well, what is his qualifications or her qualifications for doing this? Are they physicians? Are they experienced injectors? Are they board certified by the American Board of Plastic Surgery? If they're not, if they're a...
we've talked about that quite a bit, the being board certified, but that is super important.
Super important. I mean, that's a good... people ask, oh, hey, where's a good place to start? Well, start there. And then some injectors have terrific sites. Okay, well, they may be a great injector, which is terrific, but who's going to, if something bad happens, and again, I play what is for a living, who's going to back them up?
Right.
Are they working for a plastic surgery office, or are they working for a different type of doctor? Are they working for, so really dig down, and cheap becomes expensive fast when you go on some of these coupon books, or you see something in a back of a magazine you find at a gym, and so be very, very careful. It is truly not worth your life. It is not worth tissue necrosis. It's not worth that. This is your health, and really there's nothing more valuable than your health.
Right.
And now there's a new Lifetime, actually there's a new Lifetime series coming out about that as well. And so, and people also mention botch to me all the time, but more and more people are at least conscious of, hey, it may not go 100% well all the time, but one of your best ways to try to put your ducks in a row is not to be so influenced by influencers in as much as be influenced by people that have spent years and years and years trying to protect and hone their art.
Yeah, and botched, I mean, we've talked about that before, but they actually have served a really good service in the sense that they are bringing a lot of that to the forefront, especially talking about some of the practices that happen in South America, some of the stuff, people going to Mexico. And my wife's from Mexico. There's some great doctors in Mexico.
There's some absolutely terrific people down there. So where we see here in the emergency rooms in Las Vegas are folks that not went to the reputable guys and gals in Mexico or in Costa Rica or those places. And again, there's some terrific folks that give the lectures and stuff. These are the ones that are in the back alleys, et cetera, and again, cheap gets expensive really fast.
And we have that in Vegas too, right?
Sure. Yeah. So every major city has had a death of somebody that, usually it's an injectable to the buttocks or something along those lines. So yeah, if you're getting injections in the back of a tile shop, that's probably not where you want to.
Probably not a good thing.
Probably not where you want to be. And and again, if a deal is too good to be true, it probably is.
Right.
And again, seek out that. And for our folks that have Spanish as a first language, is every plastic surgeon in town that I know has somebody in their offices that speaks Spanish.
Right.
4 of them are natural speakers. So there shouldn't be a barrier, a language barrier or cultural barrier for somebody to come to a board-certified plastic surgeon.
And that's something actually, because I handle your social media, fair disclosure, and that's something we've talked about actually is reaching out to the Spanish-speaking public because we want to offer great service to everybody, not just only English-speaking folks.
And we take care of everybody. Again, with our relationship with Manny Pacquiao, the Filipino community has been coming for years as well. And so really, in our office, everyone is welcome. It's a big tent as far as that goes.
Yeah, and it's good. I mean, if nothing else, you want to be able to give them good information so they don't make mistakes that's going to cost them their lives or cost them bigger issues down the road, right?
Sure. And I've been at this long enough, when I go to the big meetings, there's always folks that have the newest Gizmo or the newest thing that lights up or the newest thing that goes ping or something along those lines.
Yeah, we were just talking about that.
And you really have to, the physician, in my opinion, has to really say, okay, does this make scientific sense, and which is why the program's so long, and they make you take all the chemistry classes and all that kind of stuff. Does this make scientific sense? And if so, is it really going to benefit my patient? And at first, is it going to harm my patient? Then it's out for sure.
Right.
But is this really going to go ahead and benefit the patient? And sure, I've got hornswoggled on a couple little things, and I'm Mr. Conservative. A couple times it just didn't work out.
Or sometimes you try stuff and
try stuff, and it doesn't work out the way it was promoted. That happens in best of families.
Sure.
But by and large, we don't do crazy stuff.
Yeah. What's some of the? I mean, I know this is always changing, but what are some of the current trends? Sure. What are some of the most common things that you actually get asked about procedure-wise?
Sure. So if you would have asked me that...
It's a big question, I know.
So if you asked me that 10 years ago, I would say a lot of stuff with the endoscope, right? So you go ahead and you make a little incision, you put a camera in, and you make a couple other incisions and use these kind of Nintendo grippers to go ahead and do the surgery. And we've really come a long way since the 90s with laparoscopic surgeries for gallbladders. Now they're using this robot with 1 or 2 incisions, and they're doing just amazing surgery. It's revolutionized prostate surgery because that used to be a tough operation, down low, lots of blood, and now
nobody wants that.
You can really, you can really see the anatomy, and it's frankly amazing. So that technology has come a long way. In plastic and reconstructive surgery, of course, microsurgeons have really continued to push the envelope of how much tissue they can transfer on an itty bitty tiny artery and vein.
It's amazing.
It absolutely. I see the presentations by the residents and the presentations by the junior faculty members, and it just amazes me now with head and neck reconstruction or breast reconstruction or all sorts of reconstruction and functional as well.
Right. So it causes less scarring. There's so many advantages.
So all of that, and so all of that. From an aesthetic standpoint, there is always somebody that's trying to push the envelope and try different modalities. For example, the holy grail in dermatology and plastic surgery is skin shrinkage, right? If you can go ahead and make a device that kind of shrink wraps the skin a little bit, whether it's neck or wherever the skin may be, and they've come at it with lasers, they come at it with heat, they've come at it with cold, they come at it with radio frequency, they come at it. So again, does it go back to, you have to go back to the white paper, does this make actual scientific sense, and then kind of go from there. And again, in that regard, nothing's perfect. If everything was perfect, we would all be using it.
And that's always, I mean, I would imagine that's changing weekly, monthly, all the time.
Right, and again, we've talked about my professor, Gil Gradinger, who said, hey, Jeff, he says, if you get bored in plastic surgery, it's clear you're not reading enough. Because there's always something. And I used to love the meetings for a variety of reasons, but one of them is hey, what's new, And then also it's something that was touted maybe 2 or 3 years ago. Folks have had some experience with it in the OR, and hasn't quite worked out as well. So that's a good reason to go too. It says, hey, this substance that we're using as an implant or something to shore up reconstruction isn't worked out quite the way we did. And so now we'll switch from A to B because this one does the same thing, but now it's better and it's better for the body. So there's always
and some of those procedures need to be like the breast implants. They need to be updated periodically anyways.
Right. So the implants themselves, but sometimes, especially in the reconstructive world, the use of, and we talked about this before, is the use of dermis, acellular dermal matrix. As a reconstructive
basically like
tool,
phony skin
is great. Well, it's actual dermis that they harvest and you put it. But back when
that's my layman's question.
No. But when I trained, if we always put the implants behind the muscle because otherwise there was problems, et cetera, et cetera. And so they said, well, we can put this as a secondary thing, fine. But now they're actually putting the implant on top of the muscle and then putting this ADM on top of it. And when I went to dinner, that night, and they put that up on the screen, I almost fell out of my chair because that was
game changer.
So it was sacrilege to me. That would have been absolute board fail. You would have failed your boards if you came up with that. And now it's becoming more and more commonplace. And so again, something that would have been absolute heresy, 10 years before, is now becoming standard of care. So that's the way science works, is you go ahead and you try things and see how things work, and you have a hypothesis, you see if you can prove it or disprove it, and all working for the betterment of the patient. So getting back to your question, yes, there's always going to be something that's a new whiz or a pop or a gizmo or something that blinks or whirs, and you just have to, in my mind, look at it with a jaundiced eye and see if it really helps the patient. And again, I'm not a guy that goes ahead and jumps on things real fast. Some guys are, and they do, and they research it, and it works well out for them. But I'm not really an early adapter per se. That's just my style.
Yeah, and you're also talking to other doctors. We were talking about Dr. Nazarian in LA. She's getting a lot of.
Oh yeah, so no, we talk all the time. I was on the phone with a couple docs, actually last night. We were talking about all things. So we talk about the certain climates in plastic and reconstructive surgery and medicine, as well as what's new, what's exciting. Hey, did you hear about what this guy did? And that, I think, comes out of, hey, do you really love what you do? Because if you love what you do, you get excited about it, you read about it, you want to share with your colleagues about it.
Sure.
And I don't hesitate when somebody comes in my office, and I'm like, that's a kind of interesting case. You know what? I'm going to go ahead and run this by Dr. Paul Steinwald up in Denver. I'm going to go ahead and run this by Dr. Lauren Rosenfeld up on the peninsula by San Francisco, because these guys may have more of an experience, or they wrote a paper, or they've done the PowerPoint presentation. I'm like, let me ask them about this.
Yeah, because sometimes the patients are, I mean, they're spending days, weeks researching what they want to try, what they want to do. They're coming to you with these questions. You're like, we can't possibly know everything.
Sure. So yeah, and again, I'm egoless when it comes to that, and I'm happy to say I don't know, but I probably know a guy. Know a guy. It's Vegas. I know a guy.
Exactly.
I got a guy that knows more about it than I do, and let me find out.
Right.
And I may send them to them. You know, I said, hey, you know, if you were my wife, I would send, or you know, my cousin, well, like, you need to go see, you know, X. If it's somebody with a, you know, a 4 times redo, you know, nose, et cetera, you know,
that's
I may not be your guy, and that's okay. I'll go ahead, and I have 2 or 3 or 4 folks that are really, really good at it, and that's what they do. And okay.
Yeah, because ultimately it's about the patient's success.
The bottom line is yes, it's all about the patient. And I tell the young residents and the young attendings coming out, I said, if you do what's best for the patient, then you'll be okay.
Right. Yeah. I mean, that's, you know, and you would hope as a patient, obviously that's their goal. They want a doctor that's looking out for them first.
Sure.
Not about, I mean, obviously you have to make money and whatever, but the ultimate outcome for them is important.
Yeah, and we're the office that says no as well. And some people look at me like I have 3 heads, and my office manager hates it. But I'm just kind of like, yeah, no, you don't need me. Like, what?
Right.
Or yeah, you don't need X, you need, you know, Y, which is.
But that's,
you know,
but that's also why you're very
exact.
you're very successful and have been for many years, is because people feel like you have their best interest at heart.
Well, yeah, yes, we do as best as I possibly can. So yeah, and that's what try to permeates the office, and that's again why I tell the young guys and gals, you know, coming into stuff, even if it's not plastic surgery, whatever it is, whatever your chosen specialty or anything else, you'll focus on, you know, the end user, the patient, the person.
I mean, that could be your mom, that could be your sister, that could be
100%.
Right. Something that actually we were talking about the other day at the office was hiring. Having a medical practice and hiring.
Sure.
So tell me about that process, because we had talked about that before, where, you know, you go through medical school, you become board certified, but you also have running a business. It's a small business.
Yes. So, and that I think is a challenge for most docs nowadays. Most doctors in the United States, majority now, are employees. They're employed by
networks,
United Healthcare, Intermountain Health, whatever it may be. P3. There's a bunch of them. And so that's a challenge in of itself at the doctor level. And again, I had 18 years of formal education post high school. I worked 120 hours a week, et cetera, et cetera. I could quote you chapter and verse from.
Hey, you've had regular jobs.
Everything else like that. And when I got out, somebody handed me a profit and loss statement. I'm like, what's this? And they're like, really, doc? And they're like, we got 0 days of business. Because the model is okay, go ahead and make all these presentations, and you want to be an academician, and you want to climb up the ladder, and okay, so you're going to be employed by, you know, an academic institution. You know, don't worry about, you know, the money and stuff like that will come, but, you know, go ahead and serve humanity and write papers.
You have guys for that.
So that's different. So that's the model.
Right.
So if you go out on your own, you want to be a small business guy, it's a whole different story. And I've made a ton of mistakes.
Yeah.
And so, which I hope to tell other people about and have them replicate.
I mean, that's important. I mean, from a lot of angles. I mean, in general, in school in the United States, we don't get financial.
No, so that's
then adding
thing.
And adding being basically the CEO of a small business.
Sure. So now you're a small businessman, so you have to, you know, deal with, you know, taxes and hiring and OSHA and all kinds of stuff. And so to answer your question is oh yeah, we've had some, you know, right now we have a fantastic staff, and I'll put my staff up against anybody. And it's a family, and you know, we say we put the fun in dysfunctional. Okay, that's because families are like that. And we don't talk about Bruno, but anyway, so you can tell I have a 7-year-old, right? And but yeah, and a couple things that people have taught me over the years is hire slow and fire fast, and we did the opposite for a while. And so I'm trying to get my headspace. And there's places I know I have blind spots. And so that's why.
It's also very competitive these days, right? To get good quality.
Yes, and we hired a practice manager who has extensive experience in this field, et cetera, et cetera. So, but we want to make sure that they're also, anybody we bring on is part of the culture. And the culture is bottom line is help the patient.
Right.
So that's the thing. And there are guys that run it much more efficiently like a business. There are guys that see patients every 7 minutes. There are guys, and they're good guys, and they do, and gals, and they do good work, and their patients are happy, and it's just
it's a
different
choice, right?
way of doing stuff. But so sometimes they can be a fantastic esthetician or injector or a back office person or front office person, but they may not work out because of a variety of reasons. So, but like anything else, it's a matter of kind of trial and error. And so far, I mean, knock wood, I'm blessed with a really good staff right now.
Yeah, and that's one thing I like about going to your office. Everybody's super friendly, obviously very qualified, and in Las Vegas too, there is a lot of competition. How do you feel about with other plastic surgeons in town? What's the overall feeling for you with as far as competing and because that's obviously there, but it's you guys are also friends. You met it
right. So everybody knows what everybody else is doing. It's still a small town, and there may be about 30 board certified plastic surgeons here in Las Vegas. And working with the medical society, Nevada needs roughly about 2,000 more doctors to get to about the 50th percentile. We're in the low percentiles for everything, especially in pediatrics, et cetera, et cetera. There's some really good guys and gals, but there's not a lot of them. Okay.
Right.
So and more people are coming to town, et cetera. The only thing that we don't need more of is plastic surgeons. Yeah, that's actually a fact. We're at the 50 percentile for plastic surgeons per. Yeah, just like we planned it. So yeah. But having said that, there are also the folks that do a lot of board construction, et cetera, so that's fine. So the folks that do what I do, basically kind of everybody knows everybody. They all know everybody else's moves. And we're fortunate because we had the Las Vegas Plastic Surgery Society for a while, again pre-pandemic, where quarterly we would go ahead and get together and we'd look at the latest papers, et cetera, but then we would actually talk to each other and just go, hey, by the way, there's this patient, she's kind of mad at you, et cetera, you might want to reach out to her. Or I'm happy to walk up to somebody and go, I heard you do a really good nose, et cetera, what's some tips and tricks? So, and then sometime when I was president of that organization, because I have to do that, is basically I would encourage the folks if they had a beef with another guy, and it's usually their darn website, and it's usually somebody puts something on their website, and it's usually the webmaster that put on. The guy doesn't even know, and so they would
the whole medical website is a whole nother.
It's a whole other piece. And I would say, come to me, come to me, and I'll go ahead and call Bob. And go, Bob, you got this on their website, you can't be on there. And they go, oh, really? Oh, God, all right, let me call, my web guy. And then just nip it in the bud. So for that, I think most of us really work well together. If, God forbid, I drop an implant on the floor, I know two guys that I can call and go, hey, I need a 425 high profile, and I need it 10 minutes ago.
Right.
And they're like, yep, okay, it'll be at the desk for you, have your office person come over. And so why? It goes off of the patient.
You have each other's back.
100%. Right. So it's really about the patient, and if you focus on that, all the other stuff goes out the window. Yeah, you can be competitive, and yes, but for me, I encourage folks to go ahead and see 3 board-certified plastic surgeons. Again, drives my office manager crazy, but because you have to fit with the surgeon, but you also have to fit with the office staff, and you have to fit because you guys are going to, they own you, you own them, and it's a relationship.
Right. Yeah. So you're basically at that point you're dating.
Pretty much.
How is this going to all work?
And there will be scars.
Right.
So
exactly. Don't we all have those?
So there's that. So anyway, so yes. But having said that, it's surgery's a contact sport. Yes, we know. But having said that, I think it's a good idea to get a few opinions so that you can get some information, some good information, and then make the decision that's right for you personally. And there's some folks that we talk out of surgery, or we say, hey, you're not ready yet, and then we've had people come back to the office after 7 years, 5 years. 12 years and go, the universe wasn't ready for me to have this operation yet. I got divorced, I got a couple kids, I got I moved my job, now I moved away, now I'm back. And okay, now they're ready, and now their headspace is in the right space.
Right, you want to set them up for success.
Right, 100%, and go ahead and get the ducks in a row. And we do that even to the fact of, okay, so you have 2 small kids, who's going to be picking up the kids for the next 3 days? Because some people don't realize, oh, wait a minute, oh yeah, I am going to need that. So again, we try, best we can, to go ahead and ask those sorts of questions so as to best set up our patients for success. And I know a lot of other folks do here in town as well.
Right, that's awesome. How can people find you online?
Oh yeah, we're all over the place. So our keystone, of course, is our website, which is www.jjroth, R-O-T-H-M-D, jjrothmd.com. And then we're all over social media with Instagram, Facebook, Twitter, all that good stuff. YouTube as well, and the Google My Business page. I think that's what they're calling it this week. They changed that a little bit.
It's always changing.
But we're all over. And again, if and yes, we look at the stuff that you write down in comments, and yes, we respond to emails, and yes, if you want to have any questions, call the office, and if you want to hear something on this broadcast or on our social media pages, ask us, and we'll most likely put it on.
Yeah, and we should say that we're actually being downloaded now in 40 countries, almost 40 countries, and we encourage people even from outside the United States to message us. We're happy to answer your questions too. And
oh, absolutely.
Awesome.
So yeah, no, I've had the pleasure and the privilege to go ahead and work with Top Rank Boxing, and so boxers up on 3 different continents, and so it's very, very interesting thing, plastic surgery. And that's what I say to the young kids as well, is education is great because nobody can take it away from you.
Right.
And it's portable. You can go with your training and your expertise or whatever you have, or if you have a trade or if you have a craft or something, you can go ahead and pick up your guitar case, or you can pick up your toolkit or whatever and go somewhere else and do your thing.
Yeah.
So always good to get education.
It's the key to success and the key out of poverty.
Right. 100%. So yeah.
Mm-hmm. Awesome. Thank you so much, everybody, for joining us. Please find us online. So definitely send us your questions. We very much appreciate you listening, and have a great day.
Have a spectacular day.